Hey everyone, today we're exploring how AI, data, and software are transforming the future of medical devices with a real expert and innovator from Orthogonal. Bernard, how are you?
Doing great.
Great to have you here. Really excited for this chat, so timely. Before that, maybe introduce yourself, Orthogonal, a bit about your journey.
Yeah, I have been in software for about 30 years. Used to work for Microsoft back in the day, started a couple of consulting companies, and slid into the medical device space by accident. We had a customer in insurance that moved into medical device and found it very interesting because unlike some other spaces, we were actually able to impact patient lives, right, and make things measurably better for people. One of the first projects we worked on in an initial pilot out of 20 patients, 3 hospitalizations were prevented as a result of that. And when I found that out, it was like, this is awesome. So been in this medical device software space for about 15 years with Orthogonal. And what we really focus on is building out the digital ecosystems around medical device companies, and then applying and tailoring modern methods to really make things more efficient, move faster, learn faster, and ultimately improve patient outcomes and value creation faster.
Love that. Well, I love the stories that entrepreneurs in healthcare have around personal experiences and helping people. And yet, what's exciting now that caught my attention is that you're building an AI factory for MedTech, and I'm intrigued by what that means and why does it matter and what's the big idea?
Yeah, so I think, if we look at what's been happening outside of MedTech and then how that's slowly moved into MedTech, we live in a world where everything is connected. Sensors are cheap. We have essentially the Internet of Everything, smartphones in every pocket, sensors and communication and everything connected through the cloud, right? And then that has allowed kind of software to transform a whole bunch of industries. And one of the big parts of that is all the data that is captured and what you can do with that data. And so AI is one of those things that's really, just as software is an accelerant, AI is an accelerant to kind of software taking over the world. And that's really been happening everywhere, where you can get algorithms, find new things that you can then inject back into the process to make better decisions, to improve and to automate. And that's really accelerated more and more. And that is happening in the medical device space as well. Again, as more companies build out digital ecosystems, they're collecting more data, not just purely device data, but outcomes data, patient data, workflow data, all kinds of things, and they're able to combine it with other things and then create more value, both in terms of efficiency of their processes, but also in terms of patient outcomes and measurable benefits.
Oh, it's a wonderful time we're in. And yet there are challenges and roadblocks. What are the toughest challenges that you see companies facing when trying to bring AI and data into medical devices? I mean, there are regulatory challenges, there's know-how, talent, skills, but
Yep.
what else?
Although I would say, just in order, I would say the biggest one that a lot of medical device companies face are, they're really not necessarily thinking about things in the same way as folks in other industries are. They're very, again, there are exceptions. People are hardware centric. Think about a piece of equipment they're selling to someone else, and really just sort of everything around that equipment and its safety and its effectiveness, but not necessarily thinking of themselves as a data company. And if you are going to play in this space and you're going to get those advantages, you have to think of yourselves as a data company. That means data is an asset. Data is not exhaust that gets thrown away. You really have to think about it from the design process all the way through, right? So that's one of the things. That mindset I have seen, talking to R&D folks at large medical device companies where we're actually connecting their devices, and they in some cases I've heard, why do we're not using this data, and that flabbergasts me, but it is very much part of the legacy in the industry. So that would be probably the number one thing, not thinking about things in terms of data as being really important, and then what that means for a company, how to actually capture that, manage that data. All of those things are sort of the baseline for any kind of AI factory and pulling that back into the system. The regulatory side of it is a big piece, right? I think the FDA and other standards bodies, agencies, et cetera, are trying to both deal with patient safety and figure out what an appropriate regulatory mechanism is, but they're always going to be behind the curve of what's happening with AI, right? How to do risk management for AI isn't easy. We have a good paradigm for machine learning algorithms and for locked algorithms, and maybe even for changing those algorithms. But we're on to other things like, agentic AI and all the things you can do with more general AI, and how to do risk management around that, how to actually have that as part of your device while being safe. That is the work that we have to do over the next 5 years to actually, make sure that as these things get more powerful, they also remain safe.
Absolutely. The other phenomenon we're seeing is MedTech moving to a connected ecosystem. I've got my Aura Ring, my Apple Watch. I just pre-ordered the AirPods 3, which will do heart tracking, and that's just getting started.
Yeah.
At breakfast this morning. How do you see devices, though, like these working more seamlessly with apps and analytics across ecosystems, not just within like Apple or Google or big tech ecosystems? What's ahead?
There's a ton of that that is absolutely happening. Aura actually happens to be one of our customers, and I think there's a couple of things that are really exciting for about things like this. One of them is just all the things all these sensors that are now in general consumer equipment that are really, really good, right? And the fact that you can get medical grade data out of them in cases like Aura, or in the case of Apple, these are things a few thousand people with prescriptions are getting. We're talking about millions of users and the amount of data that's coming out of that. I wouldn't neglect the sensors and things that are in smartphones themselves. There's even more smartphones than there are Aura rings or smartwatches, and all of those things have really, really good sensors in them that can be used for medical purposes. In fact, there's lots of companies that are also building software as a medical device, or software that is really just taking data off of those sensors, whether that's the camera, the accelerometer, what things can do, what software can do interpreting how you're typing on a smartphone. There are things under development that allow you to look at diagnosing particular diseases, bipolar, et cetera, looking at episodes out of passive data collection, out of all of these things. So tons of things that are there, both in terms of implants and wearables, et cetera, that are specifically medical device, but also on the general computing platforms. You'd mentioned the AirPods Pro. That it's something where I've talked to, the various hearing aid manufacturers for a very long time, and said, you should put more sensors on this. And there are engineers in there that have really, thought about that, but that was not part of the business plan. The ear is actually a really good sensor bed. And so when I see something like that from Apple, it's like, yes, that should have happened 5 years ago, 10 years ago. Imagine what kind of data we can get out of all of these, whether they're wearables or whether they are in the built environment, right? There's a lot we can get out of the sensors that can help us to both diagnose and then feed actually into therapies and into treatment as well.
What a wonderful vision that is. And yet with connected devices, there are real challenges, which you know a lot about. Traditionally, security is kind of an afterthought, or has been. I think people are waking up when it comes to mission critical devices, but it's still a challenge. And how do you balance, time to market, speed to market, delivering clients' expectations quickly with security and compliance and FDA certification all required to work together?
Yeah, I mean, I think certainly if you look at what, say, the FDA has done over the last 5 years, and talking to current and previous commissioners and heads of CDRH, et cetera, for various reasons, this is super important, right? Security is important for, national security, but also for device security. So the demands that the FDA has made on medical device manufacturers, anyone who is basically making medical claims for whether that's hardware, software, et cetera, that makes it a medical device, you have to have your A game in place as far as security. And so secure by design, monitoring, building out that cybersecurity risk management in the same way you do patient risk management, except everything is a moving target. So you have to think about it in terms of all of the different things that are there at design time, but that change in your ecosystem, in your infrastructure, in the devices and other things you connect to and things that are in your environment. There are lots of best practices. You have to keep up with those, and you have to, build those in and automate those. But you also have to look at, if you are building an ecosystem, who are you integrating with, and how trustworthy are the people you're integrating with? So they have to have their game, has to be great. The good news is folks like Amazon, Microsoft, Google, and Apple, they are investing tons and tons of money, many billions, tens, hundreds of billions of dollars, really, on their security infrastructure, right? So the cloud is probably one of the most secure areas for this. Areas like Bluetooth, maybe not as much in many cases, right? That's one of the big areas that the FDA is really looking at: Bluetooth security, wireless security, all of those types of things.
Yeah, a lot of work to do. So looking ahead, AI-powered devices are popping up everywhere, and I just mentioned a few that I use personally. But when will we start to see an impact on really patient outcomes, cost reduction when it comes to our, massive healthcare systems, or both?
What happens when two leaders who've built global fintech companies sit down to talk about the biggest challenge in payments? In this episode of Crossing Borders, NEMA CTO and founder Yuval Giveon speaks with Eagle Rotem, former CEO of Shift4 Europe, about why reliability in payouts is still missing and what it will take to finally fix it. Listen to the full conversation and step into the world of two fintech entrepreneurs.
Yeah, I think the easiest place where we will see, I think, cost reduction is just the cost of developing medical devices and medical device software, right? So whether that cascades through to actual sort of lower costs for patients, it's a convoluted system, so it may or may not. We'll get to that part a little bit later. But really what we're seeing just in the use of AI in the product development life cycle in the SDLC, right? Whether that is coding tools, test automation tools, just sort of looking at all the potential, gaps and errors that cause you to do rework. We're seeing right now the use of AI for us has so far made us about 50% more efficient in what we do.
That's amazing.
We're expecting that to double next year, to be 100% more efficient than we were, say, a year ago. And for our company, I've said, look, there's no reason why we can't be 4 times as efficient within the next 5 years, right? So I think that's really a lot of what is there. And honestly, I think there are things we're going to see with AI agents, with a whole bunch of other things that we still have to figure out how to use safely and what the value is, that it could be even greater, right? So I'm very, very bullish about that part of it, right? I think on the kind of getting more value through, the biggest challenge is really how we reimburse for things right now, especially in this country, right? It is very hard to do something that is, say, more earlier detection, earlier prevention, earlier treatment outside of a hospital setting where it's cheaper, et cetera. The reimbursement for that is, the landscape isn't, and it has to do with all kinds of how agencies are constructed, the laws around revenue neutrality, the specific details of those laws that make it really, really difficult to get something new in there that improves outcomes, reduces costs, but they do it in other parts of the system, right? The revenue neutrality side of it really just forces you to say, doing this very specific thing, if it exists, doing it a little bit better and a little bit cheaper, that's good. But doing it in a different way that cuts out a whole bunch of other things, that is really difficult in our system. That's probably the biggest challenge to getting improvements to patient outcomes happening, but faster as a result of this. But I think we're gonna see it. I think where there are good opportunities are around things like services around devices where things that are done that are complementary to what, say, a physician can do in their practice. And you say, okay, we will do these things outside and we'll leverage more technology, but physicians are going to get, reimbursement for monitoring and other types of things. I think it's still at the edges, rather than the core of our medical our medical practice and the costs for that. But whereas it was nibbling very much at the edges 10 years ago, a little bit more, it's getting closer to the center, and it has to, because if you just look at, what has happened to costs, what has happened to actual, the epidemics that we are facing in terms of metabolic disease, diabetes, obesity, and all of the comorbidities that go with that. We can't keep going the way we are, right? So I think that's, I tend to be an optimist, but I always feel like, oh, it's going to happen faster than it actually does. And it's really, it is much more around, around how we have designed the incentives in the healthcare systems and how misaligned they are, right?
Yeah, and I think it's a journey. It's step by step, piece by piece. And just anecdotally, I think all of us experience some progress. I've seen in my primary care uh, physician practice, they've installed these AI scribes that automatically transcribe the discussion and insert it into the EHR, and the doctor is kind of looking and talking at me versus typing into the EHR, and I'm thinking, wow, this is progress. This is not science fiction anymore. This is real. So, it's these kind of incremental advancements across the board that are really exciting. If you had one piece of advice just to wrap up for MedTech leaders around AI and a data strategy, what would it be? What would be your final takeaway?
Data has to be core to your strategy, right? And so really, if you don't have anyone in your organization who is really, let's call it, I wouldn't call it your CIO, who in theory should be the right person, but if it's a CIO or a CTO or a chief data strategy officer, you need someone like that in your organization who's really thinking about that as a core part of their system. That holds whether you are a startup or whether you are a large medical device company. All that thinking is probably the most important thinking that you can be doing over the next, 5-10 years.
You're here. Great advice. You have a busy fall season, lots of meetings and events and conferences. What are you looking forward to over the next few weeks, months?
Let's see. We're going to be down in San Diego for the AdvaMed MedTech conference. That is always one. San Diego's beautiful, and we have lots of friends and clients out there. That conference is great in terms of really all of the thinking around digital health that is going on there. Also, a lot of the work that I think AdvaMed does around lobbying for those things. I've never been a huge into things like lobbying, but I think advocacy for the industry and for patients that's happening there and it happens in DC as well through that organization is great. We are actually going to be hopefully later this fall releasing the AMI TIR 115 on cloud computing for medical devices. We've collaborated with major medical device players, but also Amazon and Microsoft and Google and the FDA on that. I think that is going to be great in terms of the just thinking through the paradigm shift of how you regulate things that are not fully under your control. So I think that'll unlock a lot of things for people. That's going to happen later this fall. And we've got a number of customers with releases of pretty cool AI and connected device platforms over the course of the rest of this year. So it'll be busy for sure.
Fantastic. Well, thanks so much for joining and sharing all the insights, and good luck. We are rooting for you and your customers. We all are patients here. So good luck onwards and upwards, and congratulations on all the success so far.
Thank you very much, Evan, and looking forward to more of the wonderful things you're doing on the podcast and the lens you have on innovation. So.
Thanks so much, and thanks everyone for listening and watching. Be sure to check out our TV show, Tech Impact, now on Bloomberg and Fox Business. Thanks, Bernard. Thanks, everyone.
All right. Thank you.